Hey friends, welcome to Nursing Online Education. In this video, we will be discussing important question and answers of different nursing comparative examinations. Guys, let's get started. Here is our first question.
1. A healthcare provider orders daily sputum specimens to be collected from a client. When is the most appropriate time for the nurse to collect these specimens? A. After activity. B. Nursing care is flexible. C. Realistic limits and controls are set. D. Physical surroundings are clean and orderly. The answer is option B. Nursing care is flexible. 2. Which factor is essential to consider when a nurse evaluates whether a unit environment is conducive to psychological safety for a confused client with dementia? A. Needs are met entirely. B. Nursing care is flexible. C. Realistic limits and controls are set. D. Physical surroundings are clean and orderly. The answer is option C. Realistic limits and controls are set. 3. A client is extubated in the post-anesthesia care unit after surgery. For which common response should the nurse be alert when monitoring the client for acute respiratory distress? A. Restlessness. B. Bradycardia. C. Constricted pupils. D. Clubbing of the fingers. The answer is option C. Constricted pupils. The answer is option C. Constricted pupils. 4. Infusion of magnesium sulfate is prescribed for a client with severe preeclampsia. The dose is twice the usual adult dose. When a nurse questions the dosage, the healthcare provider insists that it is the desired dose and directs the nurse to administer the medication. How should the nurse respond to this directive? A. Administer the dose and monitor the client. B. Withhold the dose and notify the nurse manager. C. Administer the dose and document it on the client's record. D. Withhold the dose and notify the director of the obstetric department. The answer is option A. Administer the dose and monitor the client. 5. Which nursing action should be included in the plan of care for a child with acute post-streptococcal glomerulonephritis? A. Encouraging fluids. B. Monitoring for seizures. C. Measuring abdominal girth. D. Checking for pupillary reactions. The answer is option B. Monitoring for seizures. 6. A nurse is caring for an older adult who is taking acetaminophen, Tylenol, for the relief of chronic pain. Which substance is most important for the nurse to determine the client is taking because it intensifies the most serious adverse effect of acetaminophen? A. Alcohol. B. Caffeine. C. Saw palmetto. D. St. John's wort. The answer is option A. Alcohol. 7. A client who uses ritualistic behavior taps other clients on the shoulders 3 times while going through the ritual. The nurse infers that this client has A. Blurred personal identity. B. Poor control of sudden urges. C. Disturbance in spatial boundaries. D. Reduced ability to adapt to life stresses. The answer is option D. reduced ability to adapt to life stresses. 8. A client with major depression is admitted to the hospital. What is the most therapeutic initial nursing intervention? A. Introducing the client to one other client. B. Requiring participation in therapy sessions. C. Encouraging interaction with others in small groups. D. Conveying an attitude of concern that is not intrusive. The answer is option C. Encouraging interaction with others in small groups. 9. During the first trimester, a client tells a nurse at the prenatal clinic that she frequently feels nauseated. What should the nurse teach her about reducing the nausea? A. Eat small, frequent meals. B. Take an antacid between meals. C. Drink cinnamon tincture before rising. D. Take dimenhydrinate, Dramamine, at bedtime. The answer is option A. Eat small, frequent meals. 10. A nurse is caring for a client with a history of chronic obstructive pulmonary disease, COPD. What complications are most commonly associated with COPD? A. Cardiac problems. B. Joint inflammation. C. Kidney dysfunction. D. Peripheral neuropathy. The answer is option A. Cardiac problems. 11. A new parent asks a nurse how to care for the baby's umbilical cord stump. What should the nurse include in the teaching? A. Expect a moderate amount of drainage. B. Keep the area moist with sterile normal saline. C. Provide sponge baths until the stump falls off. D. Cover the site with a small sterile dressing twice a day. The answer is option C. Provide sponge baths until the stump falls off. 12. After resection of a lower lobe of the lung, a client has excessive respiratory secretions. Which independent nursing action should the nurse implement? A. Postural drainage. B. Turning and positioning. C. Administration of an expectorant. D. Percussion and vibration techniques. The answer is option B. Turning and positioning. 13. A healthcare provider explains a cystectomy and an ileal conduit to a client with invasive carcinoma of the bladder. Later, the client expresses concerns about the possibility of offensive odors associated with this procedure. What is the best response by the nurse? A. Tell me more about what you are thinking. B. Products are available to limit this problem. C. This is a problem, but the surgery is necessary. D. Most people who have this surgery share this same concern. The answer is option A. Tell me more about what you are thinking. 14. Using Piaget's theory of cognitive development, what should the nurse expect a 6-month-old infant to demonstrate? A. Early traces of memory. B. Beginning sense of time. C. Repetitious reflex responses. D. Beginning of object permanence. The answer is option D. Beginning of object permanence. 15. An internal fetal monitor is applied while a client is in labor. What should the nurse explain about positioning while the monitor is in place? A. The most comfortable position can be assumed. B. Monitoring is more accurate in the side-lying position. C. The monitor leads can be detached when sitting on the bedpan. D. Maintaining a supine position holds the internal electrode in place. The answer is option A. The most comfortable position can be assumed. 16. During a newborn assessment, a nurse reports a sign of respiratory distress. What clinical manifestation did the nurse identify? A. Flaring nares. B. Rapid heart rate. C. Abdominal respirations. D. Decreased respiratory rate. The answer is option A. Flaring nares. 17. On the third postpartum day, a woman who is breastfeeding calls the nurse at the clinic and asks why her breasts are tight and swollen. What should the nurse consider before explaining why her breasts are engorged? A. There is an overabundance of milk. B. Breastfeeding probably is ineffective. C. The breasts have been inadequately supported. D. The lymphatic system in the breasts is congested. The answer is option D. The lymphatic system in the breasts is congested. 18. A person on the beach sustains a deep partial thickness burn because of a severe sunburn. What is the best first aid measure that a nurse should instruct the person to apply before seeking health care? A. Cool, moist towels. B. Dry, sterile dressings. C. Analgesic sunburn spray. D. Vitamin A and D ointment. The answer is option A. Cool, moist towels. 19. A nurse is assessing a newborn. What finding indicates the need for follow-up care? Babinski reflex is positive. B. Head circumference is 33 centimeters. C. Hips are abducted at 30 degrees. D. Umbilical cord has 3 vessels. The answer is option C. Hips are abducted at 30 degrees. 20. A nurse is assessing a group of older adults. Which should the nurse consider to be least likely to be affected by aging? A. Sense of taste or smell. B. Gastrointestinal motility. C. Muscle or motor strength. D. Strategies to handle stress. The answer is option D. Strategies to handle stress. 21. What should be the initial nursing action after the birth of a preterm infant with an APGAR score of 6? Check and clamp the umbilical cord. B. Dry the infant and place in a warm environment. C. Obtain a footprint and apply an identification band. D. Get resuscitative equipment and assist the healthcare provider. The answer is option B. Dry the infant and place in a warm environment. 22. Which is most important for the nurse to do when providing care to a client who has had a transurethral resection of the prostate? A. Maintain patency of the cystostomy tube. B. Ensure patency of the indwelling catheter. C. Keep the abdominal dressing clean and dry. D. Observe the wound for hemorrhage and infection. The answer is option B. Ensure patency of the indwelling catheter. The answer is option B. Ensure patency of the indwelling catheter. 23. A client on a psychiatric unit who has been hearing voices is receiving a neuroleptic medication for the first time. The client takes the cup of water and the pill and stares at them. What is the most therapeutic statement the nurse can make? A. You have to take your medicine. B. Your doctor wants you to have this medicine. Swallow it. C. There must be a reason why you don't want to take your medicine. D. This is the medication that your doctor ordered for you to make you well. The answer is option B. Your doctor wants you to have this medicine. Swallow it. 24. After a therapy session with a healthcare provider in the mental health clinic, a client tells the nurse that the therapist is uncaring and impersonal. What is the nurse's best response? A. Your therapist is really very good. B. I hope that the rest of the staff is caring. C. The therapist is there to help you. Try to cooperate. D. You have strong feelings about your therapy session and your therapist. The answer is option D. That you have strong feelings about your therapy session and your therapist. 25. A client who has just had a kidney transplant is transferred from the post-anesthesia care unit, PACU, to the intensive care unit, ICU. How often should the nurse in the ICU monitor the client's urinary output? A. Every hour. B. Every 2 hours. C. Every half hour. D. Every 15 minutes. The answer is option A. Every hour.
Thank you for watching.